What's up everyone? Today in this video I want to go and talk about what's called forward head posture, also known as forward head syndrome. Now basically, if you can imagine, in terms of normal posture, you want to make sure that your ears are over your shoulders over your hips, and then your hips over your knees, and so on and so forth. But oftentimes in our culture, in our society, it doesn't allow us to have a proper posture. If we're on a cell phone, our head shifts forward. If we're on a laptop, our head's creeping forward, or on a computer. There's all forms of different things in our society that don't allow us to really have proper posture. So what happens is this, is when your head starts to shift forward, it's almost as if you have like a bowling ball in your hands and you start to shift that hand, the bowling ball forward. What tends to happen? Your arms get tired, your shoulders get tired, your mid back and lower back might just start feel aches and pains as well, because you're shifting that weight forward. And the same thing happens to your head. As your head starts to shift forward, you're going to get neck pain, aches and pains, tension into the neck and into the shoulders. Oftentimes that can lead to things like chronic tension headaches or things like migraines. We can even start to irritate those nerves down at the base of the neck, and oftentimes what we'll start to see is we can start getting numbness and tingling down the arms and the hands, shoulder pain, arm pain, so many different things besides just not looking good. Oftentimes people come to a chiropractor just because they want to look better, they want to stand taller, and they want their posture to become corrected. So there's a lot of different things that come with anterior head posture, so we want to go and start teaching some things on how to fix that. Now, one of the most common things I see in terms of anterior head posture is what's known as chin tucks. I don't like chin tucks because what happens is this: when you start to have that anterior head posture, your chin will start to tuck in because you're doing the exercise, and what happens is as your chin is tucking, not only does it give you like a double chin, but what happens is it's going to start to strengthen the anterior neck muscles, which can sometimes cause issues in certain people's spines. Now, let me go and show you for example. Alright, so I have my spinal model here. Now, this is the normal posture that you should see. You should have this nice curve into your neck. Now, if you do a chin tuck because your head shifted forward and your spine looks like this, go for it, that's totally fine. And actually it can maybe even help the spine. But what happens is oftentimes, because we have issues in our neck, whether it be through traumas, whether it be through abnormal postural habits, our spine will start to lose that curve, and so you can get what's called a straight neck or a military spine, or you can go into that reverse curve, and that's also known as what's called text neck, because oftentimes, again, our head starts to shift forward, we're looking down at our cell phone all day, you're probably watching this video on this cell phone, and so what happens is you get into an abnormal posture here. Now imagine if you do a chin tuck, you're tucking that chin in, what happens is it can actually make this thing worse. So if you have a straight neck, that can actually start to increase that curvature and get you into what's called a text neck, or you can further aggravate it if you already have that reverse curve already. So that's why I don't like chin tucks. Some people, you can do it, for some people you may not. So it's not a very good generalized type of exercise to give to everyone. It's something that it's only for a specific type of person. Now, what should you do instead? Now, the best type of exercise that I like to give to a lot of our patients is what's called a posture pull. Now, a posture pull is basically as if you're like pulling a string up to the ceiling, right? So imagine you have a string attached to the crown of your head, not the top of it, but the crown of it. The reason why it's on the crown, because as you pull it backwards, you're going to basically be pulling your head backwards. It's going to tuck the chin in. It's going to start to lengthen and straighten, not strengthen, but it's going to start to lengthen your mid-back or your hunchback posture, and you're going to get into more of a neutral position. Again, imagine you want to get your ears over your shoulders and your shoulders over your hips. So let's say you're in this abnormal posture. Now what you're going to do is you're going to get that string, you're going to pull it up towards the ceiling, and what you're going to start to notice as you pull the string up towards the ceiling, it's going to tuck the chin in just slightly. It's not going to be that double chin, but it's going to tuck the chin in a little bit. It's going to pull your ears over your shoulders, and it's going to get you to strengthen and actually lengthen your mid-back posture. So instead of going like this, it's going to really start to open that chest. It's going to get that back to flatten out a little bit, so your posture goes into that nice neutral posture. So again, you're just going to go from wherever position you are into the abnormal posture, and you're going to pull that string up, and it's going to lengthen, and it's going to tuck the chin and get you into that neutral posture. Now you can just kind of go through here and then do it again. But you want to just hold that position for as long as possible. Get your body to get used to it. get familiar with that position. And over a period of time, you'll start to notice that your posture is in more of a neutral position. Oftentimes people will do these exercises and then they'll start getting comments like, hey man, you're standing a lot taller, you're looking a lot better. So whatever it is that you need to do, go ahead and do this. You can do it while you're sitting, you can do it while you're standing, whatever it is that you can do, just do it as often as possible. So again, I don't recommend doing the chin tucks because of certain situations that we talked about already, but what I prefer to do is doing the posture pulls, and many patients can do that in a generalized type of recommendation. And that's it guys, thank you so much for watching. If you like this video, click that like button, subscribe to our channel to follow us and watch more videos just like this, and also make sure to click that bell button to get notified of future videos just like this as well. So if you have any questions, or if you want to give us some feedback or comment below, let us know your thoughts on your posture or certain videos that you want to see in the future. Let us know. We want to help you guys in whatever way that we can. Thank you so much. I'm Dr. Robert Rosas from Ahava Chiropractic, and I'll see you on the next video. Peace.